Mary Wimbury is on the call, and I just wonder, Mary, whether you'd like to contribute.
I don't know. I've just been listening, David, at the moment. I mean, I think so. What would I say? I suppose I think the key issue is around quality of care fundamentally. And I work with care providers in all sectors, and the fundamental problem that they all raise is the funding, and in particular staff terms and conditions, because it's a very people intensive role. And it does come down to actually being able to recruit and retain. I think, as I said in the chat, I was on the reference group for this report, and I think all it's looking at is solving or potentially solving a kind of a very small bit of the equation, which is not that bit. Although if the savings they quote are available, then that may help a bit. But I think fundamentally it's it is about rethinking the system to a certain extent, about how we focus on quality. And I would say again, as Geraint said, that you can see quality across sectors as well. There are some really good private providers. There are some private providers who are taking far less money out of the system than some people in the public sector, for example, are in wages. So I don't think it's a sector issue. I think it's a sort of pan type of provision issue. I think what we need at the moment, given where we are, is a multiplicity of different sorts of providers. That includes cooperatives, third sector providers, but also smaller providers who can be well rooted in the local community, and larger providers who can have those economies of scale. And actually, if everyone brings something different to the party and everyone's learning from each other, then that's how we kind of drive up quality and drive up the system as a whole. There have been some experiments, I suppose, with transport for dom care workers. There were some grants from Welsh Government around that, in terms of using things, walking routes, setting up walking routes, cycling routes, electric bikes, electric cars, etc., to try and make it more environmentally sustainable. There's also been good work in patches on making care, domiciliary care in particular, more outcomes focused, as opposed to the sort of time and task stuff that Geraint was talking about. There was some really good stuff done in the Vale of Glamorgan on that, for example. And it is about saying to all providers, what social value can you evidence, whatever sector you're in, and what are you contributing, whether that's in terms of all the things in the Wellbeing and Future Generations Act, in terms of thinking about the environment, in terms of thinking about the actual care you're providing. And again, I think there's a really kind of mixed picture in terms of assessments. The Social Services and Wellbeing Act should mean that people do focus on those community assets. And I think it's about how we make sure that's engaged right across the 22 local authorities, but also the 7 health boards that are increasingly commissioning quite intensive home care as well, in an effort to keep people out of hospital. So I think the report is a potential solution for a small bit of the issues in the sector. Actually, there are many much wider issues that we kind of need to be completely rethinking.
Could you elaborate there, Mary?
So I think what all the report's focusing on is, if we created a franchise which existing providers and new providers could become part of, then are there economies of scale that we could realise there, and could that be used to invest in the sector? But actually, I don't think, even on the figures in the report, which, as others have said, I'm still remain sceptical about, even based on those, I think, we're still not addressing really the fundamental issues in terms of terms and conditions for the workforce and recruitment and retention, but also how we organise the system in a better way so that it actually delivers what the care that people want and need. And again, I think there are some technological solutions that could help with some of that. But unfortunately, I suppose if there were one simplistic answer, it would have been solved by now, wouldn't it?
I mean, looking at the politics of what's going on, you could imagine at one stage that when there was consideration of a national care service in Wales, that the National Health Service, because of its size and weight and political clout, would be in a position to exert some degree, if not more, in controlling like what we've been discussing and being a central sort of player. This report, in a sense, is looking at the way in which we move from a sort of a top-down statist model, trying to see how you could have a more pluralistic approach. But for me, from what I can understand of the report, it's more like old wine being poured into a new bottle. And it doesn't, for example, give any hope at all to me around how people can be more, users and workers can be more central um, in making decisions about them, rather than other people making those decisions for them. I think there's also needs to be clarity around the use of the word not for profit, because cooperatives must be sustainable. They do make a surplus. That surplus can be reinvested in different ways, as people will know, whether it's improved terms and conditions of employment or in other ways. So I don't think we should be blinded to the fact that cooperatives are there to make a surplus on their labours. We just don't call it profit. So I think there needs to be some clarity about this use of the word not for profit. And I will stop at that, Sarah. Thank you.
Yeah, sorry, it's worth flagging up as well. There's even in the profit making organisations, the formula that's in the report sort of paints a 5.7% profit margin or surplus margin for a not-for-profit. So there's not huge, even in that franchise model, there's not a huge amount of profit. I'd say most private providers would be looking at 10% profit. That's kind of where they want to be in the system at the moment. But that's I don't think that's viable. And so there's so many external conditions on the market that actually, even for us running a not-for-profit at the scale we are, we've got a turnover across Wales of about this year coming will be about £40 million, and that cash flow is so important to sustainability that it only takes a few external pressures to drown out that 5% really quickly, and you become really fragile again. So, recruitment and retention and agency usage and other factors, once they sort of start eating into the formula, it sort of erodes pretty quickly. So I just wanted to flag up. There's the days of people being, billionaires off the back of social care are probably long gone. It's a really tight model, even when it's for profit. And I suppose that's where the risk is the murky bits of the private sector, because and possibly even the not-for-profit sector, that pressure to be sustainable will drive quality degrading behaviour. I suppose that's you will end up with corner cutting when the model doesn't stack up financially. So it's to the point around quality monitoring, and it's a valid one. There needs to be really good transparency through the system.
Can I just put a point to the meeting? I think we've had a fairly good discussion, and I'm really pleased that some of us bit the bullet and decided that this particular report required some degree of public attention. I'm just wondering if there's a recommendation that we could make to the Wales Party Council. And I'm particularly thinking about the ways in which we can actually widen the debate and the contribution that service users and workers can actually make in trying to resolve some of the complex issues that we've been discussing, rather than it just being left to task and finish groups and bigwigs. There needs to be a citizen's voice, I'm sure, in all of this. And I wasn't being disrespectful to Mary's contribution, but it just seemed to me that the public voice is missing. It's just taken as for granted that we will put up with whatever is dished up. And I'm sorry, things are going to have to change. And maybe I speak out of self-interest there. But I'm just wondering what other people actually think about how we can actually progress this conversation, which has been very productive today, Sarah.
Yes, it has. Yeah, I think we need perhaps put responses to the report, and I don't doubt there will be policy discussions coming forward, Welsh Labour Conference and elsewhere.
Did Mary Ann want to say anything? She's been quiet.
Mary Ann, are you coming in now?
Do you want to come in, Mary Ann?
I think that was a cough.
No, it's fine. Thank you. I won't this time.
I was going to ask, Geraint, before we move on, I was just going to ask whether you feel that the cooperative model gives you an edge in terms of your recruitment and retention.
Yeah, it's an interesting prospect. I think externally, well, two things. I'm not sure how good we've been at painting the picture of how attractive that could be, and we're investing lots in trying to improve our external voice and message and getting that across to people. The pandemic really slowed us down in terms of being able to really embed our cooperative forums and getting the structure, having enough autonomy and discussion to make decisions and have influence over the organisation. So we're kind of playing patch up. So I think in time it definitely could. I definitely think it is a USB that is an interesting offer for staff in the sector. I'm just not convinced how much understanding there is outside of our organisation in terms of if you're new to social care and you're looking for a job and you go to Indeed and all the usual places to find one. It's on us, I suppose, to really put across the value and why that's different. And we haven't done that hugely effectively yet, but we're trying. So I suppose what I'm saying, I don't know if I got enough data to say what it has helped. I think is some people do really have enjoyed the journey and do value it and have stayed as a result of the transformation into a cooperative. So I think once you're inside the organisation, it starts to make much more sense. But we got lots of work to do, I think. Yeah.
Mary Ann, you wanted to?
I did want to come in because I had a hard job joining the meeting. You may have already discussed this. I think one route we have got is the requirement under the Socially Responsible Procurement Act in Wales, and also the Procurement Act in the UK. Now, in our council, we've developed a strategy, and we're now in the process of looking at the policy that falls out of that. But every public body has to look at this, and it's really important that into those strategies and policies, which every public body must have, that cooperatives is inserted as one of the choices to be made, but also looking at ways in which procurement can be simplified to allow micro cooperatives and other SMEs as the route in to be on an equal level playing field when social care goes out to procurement. It is part of the Eliminate agenda, I think, to ensure that we make it as fair as possible for not-for-profit providers to have the same access as for-profit providers. And I don't know whether we've discussed that, but I think if we go back to our unions, but we also go back if we're in public sector, to really check that these procurement processes and what staff are supposed to do during social care, if they procure any social care, that they are looking at cooperatives or not-for-profits if there isn't a cooperative available. And also that you'll find that they're given guidance on where to go to advice. We need to insert that they can go to Compass for advice. All this sounds very simple, but actually, if we don't get it into those documents, it's actually very hard to change the way that the public sector is procuring social care.
Mary, can you explain to us what the Wales Court Party Council might do in that respect? Is there a short statement that we can put together arising from this meeting, which would enable us to push that point via them, so they can, push that, if you like, across a wider.
It should be very clear to all public sector documents that the Welsh Government in particular is encouraging them. They don't name cooperatives. That's the issue. And I have had a series of interesting conversation with the procurement officers in Torfaen and Cardiff that support us. They don't name cooperatives. They name small SMEs, micro providers. This is across, it's not just for social count, and third sector organizations. And I am asking and have been asking that we actually name cooperatives. The Welsh legislation says that we should be, where possible, using a diversity of providers where it is appropriate, including third sector small SMEs. And that's because 85% of Welsh business is SMEs or below. But I think we have to start getting it into the culture of public sector that cooperatives, yes, are third sector, but they are different.
So there's an awareness piece there, isn't there?
Yeah.
Mary, you wanted to come in?
So I was just going to say, the cooperatives are mentioned in the Social Services and Wellbeing Act, and there's a duty on local authorities to promote social enterprises and cooperative models of delivery. I think that hasn't been taken up, and I think that is often due to a lack of understanding of co-ops by those commissioning care. But I think that might be a more fruitful route, not least because a lot of social care isn't procured as such, because you have things like the choice of the service user, quite rightly, to take into account where the service is being procured for them from, as it were. It's actually comes under the duties under the Social Services and Wellbeing Act. So I think in this particular instance that might be a more helpful route.
Yeah, I agree, and I think there's is section 16A which talks about that, and it puts a duty on all local authorities to have them section 16A forums to help themselves organise that and engage with the sector that's there to do that from. So yeah.
Can I just say that as part of history, both Adrian Roper and I were involved in actually redrafting the regulations and the act in terms of what you're actually saying. But when I certainly attempted to do this in the Newport area around 2013 onwards, the obstacles that we had from officers was as if we were actually in competition. Either with them or information was confidential and couldn't be shared with upstarts such as cooperatives that wanted to provide a more diverse provision of services. So there's something around, the mentality, the ideology that people have. It's not just regulation that needs or will assist here.
Yeah, there's often an understanding gap. I mean, I know historically there's been a tendency to contract with the third sector differently to the for-profit sector, that with the third sector it tended to be grant-based and or an SLA open book where an assumption that they may well be able to bring in some grant to support the service. Whereas with the for-profit sector, there is an assumption that there will be a profit element built into that contract. So, I mean, I know we're moving away from that now into a level playing field, but I don't think, I'm not sure that we're entirely there yet.
Is
I don't
Kylie?
know whether that's your experience, Geraint.
Yeah. Sarah, could I make my contribution if that's okay?
Yes, of course, Kyle.
Oh, thank you. I just a quick number of thoughts really. I mean, putting people at the heart of decision making. I mean, I was just wondering, are we talking about like day-to-day workers in the domiciliary care or people external really? And for example, what sort of training is there for people to make decisions for the industry? Is it for the present? Is it for the future? And what is the future of domiciliary care really? Because you've got the various different industries, but what training programs is there to make sure domiciliary care today reaches the needs of the population and no one gets left behind really? Just a couple of things really.
Yeah, you're raising some important issues there. I'm not sure that we'll. Yeah, I mean, obviously training and culture are very important there, aren't they? Moving us forward, where do we want to go with this? David, you're wanting to send a minute or something to the Wales Co-op Party Council
Well, I'm
to ask them to take it this, or is it best that we all perhaps go away and finish reading the report? And and do we want to make a response? Is this a consultation at this stage, or where are we?
it may well be that we ask people to reflect and come back to us in a very short period of time around any recommendations they would like us to actually make collectively to the party council, so that can actually be fed into the policy making role that they have. I think that would be the simplest way, I think, of trying to bring things together in a concrete sort of practical way, rather than trying to do that now.
Sure.
So
Are you volunteering to be the conduit for that, David?
I'm happy to receive comments, and if we could have those within the next, I know it sounds a bit daft me saying in the next 7 days, but the point I usually say like within the next 24 hours in a sense, because if it's something on the tip of your tongue and you feel it's important, then it may well be that we say by the end of Monday, if people have got very specific comments, then I'm very happy to draw those together with you, Sarah, and to share those with people online. In this conversation, to see if we can actually agree some text that can then go to party council. But I think that's the best route for influencing.
Do people feel that would be helpful and appropriate? Yeah.
Can I suggest we?
Sorry, does anybody have any other suggestions as to where we take this? Or are we happy with that as a route forward?
And don't worry about if it's just like a bullet point or one idea, or even if the spelling isn't correct, don't worry. That all can be sorted. What we're looking for are very specific, practical, authentic sort of comments that are practical, that can move the agenda forward. And if other party members from North East Wales, such as Jackie and Mary, can be part of that conversation, as well as
really helpful.
Cymru, that would be incredibly helpful. Then we've got a diversity of view, and it may well be that there are alternative suggestions actually being made. And all I need to be certain of is I'm sure that Rebecca and Tess are with Geraint, are they?
Yeah.
Yeah, that's fine.
Yeah.
I've got everybody else's emails at my fingertips, so no difficulty there.
Great. Well, Thank you, Geraint. I think that's been a really useful and informative session. Is there anything that any of us can do that you would find helpful? Anything that we, how can we support?
Yeah, thank you. Thanks for having me. It's been really good. I suppose I'd be really interested to see where you land in terms of your feedback, and so it'd be great to keep in touch with David to see that. And yeah, I suppose just ongoing, keep in touch. It's it'd be great just to keep involved, and happy to help, and I'll be happy to help for
Well, I mean,
in the future. Yeah, great.
One of the things that we want to do as a branch is to talk with and hear from a cooperative about their issues when we meet, and also to be part of growing that awareness of the cooperative sector. So, if you want to tell your team that the Co-op Party exists, then
great. Yeah, we'll do that. Yeah, fab.
That's a good thing.
Sarah, I've just typed one other thought. This has been probably one of the most interesting and best attended meetings that we've had for a while. And I think I'd like us to, it may well be that what we should do is to have a further conversation involving a multi-stakeholder cooperative in England, because there are one or two, I think, in the Yorkshire area, so that maybe we can get a bit of cross-fertilization going.
Yeah,
how we can
great idea.
break this sort of log jam. So that's my other sort of suggestion. And that could be organized very simply and very easily, I'm sure. And I think we'll probably be able to get Cheryl Barrett, who's also very close with us on this issue, who's chair of Cooperatives UK, to be part of that conversation as well.
That sounds like an excellent idea, David. Does everybody else feel that's